iliac artery. Internal iliac artery, after its origin from the common iliac artery, it passes or laterally at the upper margin of the greater sciatic foramen. This internal iliac artery then divides into anterior and the posterior divisions. Anterior and posterior division to give rise to different branches. First, if you see the branches which are coming from the anterior division, and these branches are the umbilical artery. Okay, this umbilical artery, when it proceeds down, it gives rise to the formation of the superior vesical artery. This is the superior vesical artery which is coming by the umbilical artery. So, umbilical artery, then the superior vesical artery. Then there is obturator artery, and this is the obturator artery, you can see, which runs downward along the lateral aspect of the obturator internus muscle along with the nerve which is named as the obturator nerve and the vessels. Okay. Then you have the inferior vesical artery. Inferior vesical artery which supplies the inferior aspect of the base of the urinary bladder. It also in the male it gives rise to the artery to the vas deferens. Okay. Because on the posterior aspect of the urinary bladder you will see that here is the presence of the vas deferens. Then we have the middle rectal artery and the internal pudendal artery, then inferior gluteal artery, and in the female we have the uterine artery. This uterine artery then when it enters again in the broad area of the broad ligament, it will give rise to the branch which supplies the vaginal named as the vaginal artery. So these 6 or 7 arteries, they are originating from the anterior division. Then if you see the posterior division of the internal iliac artery, one branch of the from the posterior division, it ascends upward, which is named as the iliolumbar artery. Okay, iliolumbar artery. Then you have the lateral sacral artery. Lateral sacral artery, it descends down. If you have this sacrum, lateral sacral artery, it descends down like on the lateral wall of the pelvic cavity. This is the lateral sacral artery. Then the third one is the superior gluteal artery. On the posterior division of the superior gluteal artery, it arises and leaves the pelvic cavity from the greater sciatic foramen to supply the gluteal region. So you should know that at which point the internal iliac arteries, they are dividing and giving rise to anterior and the posterior division. What are the branches of the anterior division? The 7 or 6 or 8 branches coming from the anterior division, and the one which are coming from the posterior division, that is the which is one going toward the posterior abdominal wall, iliolumbar artery, superior gluteal artery, and the lateral sacral artery. So these are the branches coming from the internal iliac artery, where when this artery reaches at the upper margin of the greater sciatic foramen, then divides into anterior and the posterior divisions. Okay? Which one? Inferior vesical artery. Look, superior vesical artery coming from the umbilical artery. And inferior vesical artery, basically it is arising from the lateral sacral artery. Okay? Which then goes toward the inferior aspect of the base of the urinary bladder. But in case of male, this inferior vesical artery, when it reaches toward the base, it supplies vas deferens. Okay? Not in case of female, but in case of male, then its inferior vesical artery gives rise a branch which supplies to the vas deferens. But in case of female, the uterine artery, then the uterine artery goes give a branch which is named as the vaginal artery. Okay? Yes, clear or not?
Doctor, umbilical artery going to the umbilicus or?
Umbilical artery, basically, as its name indicates, going to supply the not to the umbilical region. It originates at a higher level, and then it as goes towards the superior aspect of the bladder, its name changes to the superior vesicle. So arteries of the pelvis, okay? Any other question? You are very busy, that's why. So this shows the posterior divisions of the and now we comes to the veins. Veins, they correspond to their arteries, and they are the external iliac vein, internal iliac vein, and median sacral vein. Same external iliac vein is formed by its two tributaries, main two tributaries, which is the what should be the two main tributaries for the external iliac vein.
Deep circumference.
It is the continuation, but just above the inguinal ligament, it unites two veins, which were the branches of the artery.
Deep circumflex.
The epigastric and deep circumflex iliac. Okay, it unites with the fibula and then gives rise. Then internal iliac vein, same. The branches which are coming from the anterior and posterior division, they unite into anterior and posterior veins, and then they continues with the internal iliac vein. Median sacral vein is same. When it is entering artery from its supply, basically the median sacral vein drains into the right internal iliac vein. Median sacral vein it drains into the right internal iliac vein. Okay. So arteries, sacral plexus and the arteries of the pelvis is clear. How the lumbar, yes. Median sacral vein is written in the snell that it usually drains into the right iliac vein. Right. Right internal iliac vein, not common iliac vein. Right internal iliac vein, then goes into the. Now we come to the arrangement of the structures, pelvic organs or the structures in case of male and the female. As you can see in this diagram, when we start from the anterior abdominal wall, when we see over the anterior abdominal wall, this is the anterior abdominal wall, and this is the pubic bone. Then if you see just first structure which is coming just below the pubic bones is the below and behind the pubic bone is urinary bladder. Okay, then this is the case of the male. Okay, behind the bladder, if you can see what is structure is present behind the bladder. Rectum. Okay, just in contact with the bladder we have the seminal vesicles. Okay. This is the ejaculatory duct and the seminal vesicles is there. This is the main organs in arrangement in a lateral view. So first is the urinary bladder, then posterior to this we have the rectum. Okay. Now what happens? The peritoneum, which is coming from the after covering the abdominal organs. They are coming from above and it will come over the superior aspect of the urinary bladder and passes posteriorly over the posterior aspect of the base of the urinary bladder up to the ejaculatory ducts, and from there it will pass posteriorly over the anterior aspect of the rectum. Now, if you see the rectum, this rectum, the arrangement or the surrounding which is covered by the peritoneum is different on the three parts of the rectum. Usually rectum has been divided into three parts. Upper one third, middle one third and the lower one third. The peritoneum which is reflecting from the urinary bladder goes towards the anterior aspect of the bladder. Now over the anterior aspect it covers the anterior aspect of the rectum up to the middle two-third of the anterior aspect of the rectum. Is it clear? This is the bladder, rectum. The peritoneum from the bladder, it comes over it. Now this whole length is divided into three parts: upper one third, middle one third, and the lower one third. Okay. The peritoneum which is coming from the bladder, it comes like this up to the anterior part, where upper two-third part of the anterior surface. Upper two-third part of anterior surface. Now peritoneum covers the again upper two-third part of the anterior surface. Now from this it reflects laterally and covers the upper one-third of the lateral aspect of the rectum. Clear? Like this, it is covering the anterior two-third or anterior surface of the anterior two-third of the rectum. Then it passes laterally to cover the upper one-third of the lateral surfaces of the rectum. Why it is going towards this? Because then after that it will pass towards the lateral wall of the pelvic cavity. Lateral wall of the pelvic cavity to become continuous posteriorly with the which part of the visceral part and parietal part of the peritoneum or parietal peritoneum. Is it clear or not? You can ask again. Coming from the urinary bladder, it passes posteriorly over the rectum. Now rectum is divided for the purpose of description of this peritoneum into three parts: upper one-third, and also for the blood supply it is also divided into three parts: upper one-third, middle one-third, and lower one-third. When this peritoneum from the bladder it goes over the rectum, it anteriorly it covers its upper two-third part. Means out of three, peritoneum covers anteriorly the upper two-third part of the rectum. Then from there it passes laterally to cover the upper one-third parts on each side of the rectum. Because then after that it will go towards the lateral and then to become continuous posteriorly with the parietal peritoneum. Yes.
Is there another name to the median sacral vein?
What is the name?
I'm just asking because
What is the other name of median sacral vein? Go and see and then tell me tomorrow.
because I'm looking at the application and identified median sacral vein.
Median sacral vein, basically it is said that it is one of the tributaries of the internal iliac vein. Because whenever any area where the artery is going, there must be a vein. Okay, when this median sacral artery going and giving branches, so there must be a vein. So these small tributaries, they unite and form the median sacral vein, which then drains into the, as it is written in the snare, towards the right internal iliac vein. Okay. You will go and see. I will also find other name, and then we will discuss it tomorrow. Okay. Remember it for tomorrow. So, is it clear now how the peritoneum from the bladder goes toward the anterior aspect of the rectum to cover the anteriorly upper tooth, upper one and the middle one, that is the upper two-third. Then from here it reflects laterally to cover the upper one-third on the lateral side, then goes laterally and continues posterior with the parietal peritoneum. Now this area, after it's, when it covers like this part of the reflection of the peritoneum. What is the name of this part?
Pouch.
This is named as rectovesical pouch. Rectovesical pouch, and this is when the person is standing, and this rectovesical part is the deepest part or the lowest part of the peritoneum. So any accumulation of fluid in the peritoneum, it goes first towards the rectovesical pouch. Okay. So this is the arrangement of the viscera. You can see first the just. Now second thing is there. When there is obstruction in the passage of urine due to any cause, maybe due to some accident or maybe due to the stone over its exit, then what will happen? This urinary bladder is already known, it has the capacity to accumulate the urine up to 500 ml. Okay? Then this urine, at the moment we have the anterior abdominal wall contact, over here where we have peritoneum. Now with the increase in size of this urinary bladder, like this. Now you can say it ascends upward into the abdominal cavity. Initially it was in the pelvic cavity. Now with the accumulation of urine, this urinary bladder then increase in size and it reaches into the abdominal cavity. What will happen? This peritoneum, then it will be reflected back like this. Or you can say it will be pushed back like this. Now what is the purpose? The God has given this opportunity. When there is obstruction due to the stone or due to the accident, rupture of the urethra in case of male, this area which of the urinary bladder comes above, it lies in contact with the anterior abdominal wall. Anterior abdominal wall, then it will be very, when there is accumulation of urine, the patient will be in severe pain. He cannot pass the urine, but to give relief to the patient, then there is a procedure done to drain this urine out into the bag. This is named as suprapubic puncture. Suprapubic puncture is done to give relief to the patient to drain the urine, because its only exit is through the urethra, which is blocked either due to the stuck of the stone or due to the rupture of the urethra. Then this to give the relief to the patient, in the hospital it is done suprapubic puncture to release or to release the urine from there into the urinary body. So this is the significance of the capacity of the urinary bladder to increase in size and to enter in above the pubic bone into the abdominal cavity, so that now by this procedure you cannot enter into the peritoneum. So peritoneal puncture is protected because it is pushed up, and you can drain the urine by doing the suprapubic puncture. Suprapubic puncture. Suprapubic puncture. So suprapubic puncture is done. This is the case in case of clinical application. Now, if you see this was the arrangement and the reflection of the peritoneum and formation of the recto-vesical pouch. Now we come to the case of the female. In case of female, as you can see, the peritoneum after coming the intestinal organs, it comes over the superior aspect of, again same, superior aspect of the urinary bladder. Okay, superior aspect of the urinary bladder. But in case of female, in addition, posteriorly we have the rectum. There is another internal reproductive organ which is named as the uterus. Now, this peritoneum, which is now first coming over the superior aspect of the urinary bladder, where it will go? It will ascend upward over the superior aspect of the uterus, then passes superiorly, then backward up to the superior part of the posterior, because this uterus continues below with the vagina. Okay, so this passes from superior aspect posteriorly downward up to the superior part of the vagina posteriorly. Superior part of the vagina posteriorly. After that, it will pass back over the anterior aspect of the rectum. Okay, same arrangement in the middle 2/3 up to the middle, and then again goes laterally from the covering the upper 1/3 part of the rectum, same to that of the male. Now, in this case, you can see by the covering of the bladder, then moving to the uterus, then again going posteriorly between the uterus and the rectum, two pouches are formed. First pouch between the urinary bladder and the uterus. This will be named as the utero-vesical pouch. Utero-vesical pouch. Second, when it passes above and posteriorly up to the posterior aspect of the upper part of the vagina and then to the rectum, this another part will be named as the recto-uterine pouch. Recto-uterine pouch. Recto-uterine pouch. And in the female, in the erect posture, this is the deepest part of the peritoneal cavity. Okay, so this is the reflections of the peritoneum in case of male and female. Male, only one pouch is formed, which is named as the recto-vesical pouch. But in case of female, due to the presence of the uterus, two pouches are formed. One is between the uterus and the bladder, utero-vesical pouch, and one between the rectum and the bladder and the uterus, recto-uterine pouch. Okay? Pouch of the breast. Okay, now after covering this peritoneum in case of female, when it covers the uterus, this is the uterus. Now this peritoneum, when it comes over the uterus, it covers anteriorly because of the formation of utero-vesical pouch. Okay, and posteriorly because it is forming the recto-uterine pouch. Now, when it covers over the, then I have a page, plain page.
Okay.
Just one page. Now, it will lie over the. This is the uterus, okay, and this peritoneum is covering over the uterus like this. And this part, it is said, when it covers the peritoneum covering the uterus, this part forming the two layers. This is named as the broad ligament. Broad ligament is what? It is a double layered fold of peritoneum covering the uterus. Now you can see the laterally on both sides it is open. After covering the uterus anteriorly and posteriorly, this broad ligament it passes laterally towards the lateral wall of the pelvic cavity. Okay? Lateral wall of the pelvic cavity. Now inside we have the uterus and which continues down with the vagina. Remember it. This fold of peritoneum, this what is the name of this fold of peritoneum now? It is broad ligament of the uterus. Laterally, if you see on the, this is the uterus, okay, uterine cavity, and this is the uterus. Laterally what we have the and they are lying within the fold of the broad ligament. Now it has an anterior layer and a posterior layer. Now in the posterior layer, if I draw with the marker like this is the area where the ovary is present. In the posterior layer of the broad ligament, there is presence of the ovary which is attached with the posterior layer by means of a fold named as mesovarium. Mesovarium, it is written over there. The ovary is attached with the posterior layer by means of mesovarium. Okay, and then further part of this posterior layer which goes towards the lateral wall of the pelvis. This is named as the suspensory ligament of the ovary, extending from the ovary laterally towards the lateral wall. Mesovarium, clear? This is the ovary and it is on the attached with the posterior layer by means of mesovarium. Now what happens? This layer, posterior layer, okay, if I remove this anterior layer, see this posterior layer, after it is attached with the posterior layer, the part of the posterior layer going towards the lateral wall, this part will be named as suspensory ligament of the ovary. Okay? Clear or not?
What happens to the broad ligament in the pregnant woman?
In the
Pregnant woman. Pregnant.
what happens now? This broad ligament, it when there is pregnancy, increasing in size of broad ligament. What? It is a fold of the peritoneum. Like in the male when there is accumulation of urine, or in female any. What happens? Due to the increasing size, the peritoneum moves up. Same in case of female, with the increase in size of the uterus due to the baby, it moves up, it gives space for the accumulation of the baby in the uterus. Due to increase in size, the peritoneum displays. It is not attached actually, it is covering the organs. So with increase in size, it moves up. Clear? So from there to here, lateral wall, this will be named as the suspensory ligament of the ovary. Now the remaining part of the ligament which is attaching the ovary with the uterus, this is named as the suspensory or specific ligament of the ovary. Ovarian ligament. This is named as the proper ovarian ligament, and this will be the suspensory ligament of the ovary. Clear? So now this part, there is another part superiorly, because when the ovary is produced in the posterior layer in the ovary, this will be released and will be taken by the fimbriae of the fallopian tube, and then it moves into the uterus. Now, where it opens, where it is at the superolateral corners of the uterus. Now, as this is covering the uterus, now the part of the fallopian tube which runs from the ovary and reaches to the superolateral corner of the uterus, this will be named as the mesosalpinx. Mesosalpinx. This is the part of the layer which lies in the posterior layer of the ligament of the uterus. Okay? Is it clear or not? You can ask again. Mesosalpinx. Mesosalpinx, as I said, this ovary laterally is attached with the suspensory ligament, and this is the ligament of the ovary. Now, from ova which is produced, taken by the uterine tube into the uterus. Now, where is this? This is in the upper part of the posterior layer. This uterine tube is in the upper part of the posterior layer of the round ligament. So that part of the round ligament which has this uterine tube, this is named as the mesosalpinx. Mesosalpinx. Mesovarium having the ovary. Mesosalpinx having the uterine tube, which is carrying this ova from the ovary towards the uterus. Clear? So two terms are used, mesovarium and the mesosalpinx.
Yes.
Any question? Now, if you have any question, you can ask. Make it clear. So we should keep in mind that the peritoneum from the bladder coming over the superior anterior and the superior aspect of the uterus, then passes posteriorly up to the beginning, upper part of the vagina. Okay, like this, it is coming from here and then it is deflected over the rectum. Then it is deflected over the rectum, then so that it is covering the uterus like this. Now, lateral side, I told you that what is the position of the mesovarium and mesosalpinx, and there is a passage also. As I told you, the ovarian artery which is coming from the abdominal aorta, enters into the pelvis, passing in front of the sacroiliac joint, then passes behind the ureter and enters into the true pelvis, and then this vaginal artery from the lateral wall of the pelvic cavity enters into the broad ligament like this, and then it supplies the vagina. Similarly, here we have the uterine arteries also. So they are coming from the lateral side. You will see this one. Here you can see this diagram, this part of the diagram. This shows the lateral aspect, where the space is there. Anteriorly and posteriorly you have this blue color, which is the peritoneum. Laterally it is open from where these structures are entering and leading towards the uterus and the vagina. That is the blood vessels. Okay? This part of diagram showing the exact position. This is the anterior aspect sagittal section, and you can see the broad ligament which has been cut, the anterior layer has been cut to show you the ovary, and from the ovary you have this ligament, laterally suspensory ligament, and medially the proper ovarian or the round ligament of the ovary. This is how they are covering laterally, going toward the lateral wall of the pelvic cavity. Clear? Yes.
Is the ovary attached to the uterine tube?
Ovary attached with the uterine tube? No, there is no proper attachment actually. This is, suppose this is the ovary, and over its upper pole, or where the ova is coming out from the ovary, the fimbria of the uterine tube is covering like that. So when the ova comes, they suck and then passes through the uterine tube towards the uterus. Actually, there is no attachment, but it is that pole from where the ova comes, it which is surrounded by the fimria of the uterine.
What is the another attachment with the accessory ligament in the other side?
In which side?
With the other side.
One side is with the ovary
Yes, other
and
side.
one side with the lateral wall of the pelvic cavity. Okay? And then there is a space between the two layers from where the vessels can enter, uterine and the vagina. Yes. Now, if you see with reference to this previous diagram which I have shown over here, now we come to the content. What are the structures present in the broad ligament? These are the uterine tube, as I said, in the upper border. We have the round ligament of the ovary and the uterus, and uterine and the ovarian blood vessels. And when you will do the development of the kidneys, then you will come to know there is two vestigial structure left. They will be named as epiphuron and periphuron, which are the vestigial structures after the formation of the kidneys and the mesonephric duct. These two vestigial structures, they remain present in female in the area of the broad ligament. So these are the 5 structures: uterine tube, round ligament of the ovary and the uterus. Then you have the uterine and the ovarian vessels, and the two vestigial structures named as epiphuron and periphuron. They are present within the folds of the broad ligament. Round ligament of the ovary, the part between the uterus and the ovary. This is named as the round ligament of proper ovarian ligament. Round ligament of the ovary. And this one is the suspensory ligament, which is lateral. Okay. So these are the structures which are present in the round ligament of the ovary. This sympathetic part has been done by Dr. Mozher or not?
Yes.
Sympathetic trunk coming from the surrounding the abdominal aorta and then intermediate vessels. Has he covered or not? I will ask him, then I will do it. So this is all about the nerves of the pelvic cavity, that is the sacral plexus. Then we have the blood vessels, that is the arteries and the veins which are supplying the pelvic organs of the structure. Then we have the arrangement of the structure in female and the male, and the reflections of the peritoneum giving rise to the formation of the pouches. Yes. Superior and posterior up to the seminal vesicle. Then from there it is reflected.